Hello, my name is Heather Jimenez, and I am one of the Cleveland Clinic main campus emergency department staff. In March 2020, coronavirus, otherwise known as COVID-19, emerged in Ohio in association with the global pandemic. Much was unknown about this novel viral strain, except it seemed to cause profound illness in many and unexpected morbidity and mortality. To properly care for patients, caregivers had to be safe. This led to new protocols for resuscitation to limit the spread of disease. Mock codes have previously been utilized as a model in the emergency department for pediatric education. Because of the safe learning environment, realistic nature of the simulation, and ability to practice skills in the same environment in which staff regularly work. Thus, simulated mock codes were utilized as the model for education of new COVID-19 protocols. In April and May 2020, in conjunction with the CCF American Heart Association team and simulation staff, in situ mock codes were practiced in the main emergency department. All staff physicians, residents, nurses, medics, physician assistants, and respiratory therapists were invited to practice skills which focused on caregiver safety and limiting disease spread. Protocols developed by the ICU were practiced repeatedly until participants felt comfortable. Main highlights of these novel protocols included: 1. Personal protective equipment first. All caregivers had to be protected before entering the room. This included N95s, surgical masks, eye protection, plastic gowns, and gloves. 2. Limiting aerosolization with no bag valve mask ventilation, covering the patient's face with a hood or drape, using a glide scope assisted intubation only, and rapid use of eye gel and cricothyrotomy if needed for airway management. 3. Emphasis included defibrillation first for shockable rhythms and early use of CPR assist devices. All caregivers were taught how to rapidly use the Lucas device for CPR, including proper placement and how to manage the controls. And 4. Ventilator management changed to include the verbalization of confirming viral filters are in place and ventilator use in cardiac arrest, since this is a major change from standard ACLS protocols during this COVID pandemic. The pictures on the poster include examples of intubating with the glide scope and hood, using the Lucas device for CPR, and practicing with personal protective equipment and ventilator during a simulated full arrest. Because of these in situ simulation sessions, caregivers have increased confidence in safely resuscitating suspected COVID patients. Changes adopted include having someone at the door to ensure proper PPE and use and protocols, improved bedside and department communication, and the recognition that this new standard of care can protect oneself